One of the things that strikes me about the work that you've done is that the innovation is as much about the management as the science. So I wonder if you could tell me a little bit about whether it's on the people side of things or any major change initiatives you've had to lead. Tell me a little bit about your leadership and management style and what has allowed you and the people you work with to flourish.
So I think the key feature in overseeing a science agency is that you're working with a lot of incredibly talented people with a lot of different approaches to problems, different backgrounds, different ideas. Each person is an innovator. And in order to channel the innovation, you need to be able to listen to people, to talk to people, to create consensus around new policies and programs, and to get the support of your colleagues. And so I mentioned to you before, and I really feel this is important, every kind of program or project that we've started at the NIH has started with listening to people, putting together their ideas in a way which could lead to real advances. So I think in terms of my own management style, that's the number one: listen, listen, listen.
So if you were to generalize from your scientific method to maybe some management principles, there are obviously a lot of medical and scientific experts in the HHS community, but there are others as well who focus on management and operations. How might you generalize some of those techniques and approaches to your more run-of-the-mill
That's a terrific question. One of my mentors and advisors early in my administrative career was Ruth Kirstein, who was a legendary NIHer. She was the first woman director of the National Institute for General Medical Sciences. She was an acting director of the NIH. She was a very high NIH official and understood a lot about administrative problems and how to deal with them, was a scientist herself. And she said that she found that moving from pure science to administering science actually made her appreciate that administrative problems were in many ways very similar, and in some cases more complicated than problems related to simple problems in the lab. The major difference being in the lab you can manipulate the system you're working with, whereas it's much more difficult in human populations. But I think some of the same logical principles pertain. I think we try to do simple experiments, and if we introduce a new administrative procedure, for example, we try it out on a small group, we make sure it's working, we get feedback, and then we expand it to a larger group of people. So we take a kind of evolutionary path in solving problems that I think works well in the laboratory as well in the clinic.
So whether it's science or management, you have good days and you have bad days. You certainly, I'm sure, at different times have faced resistance to initiating some new program or activity. How do you remain resilient, sort of resolute throughout that experience, and maybe ultimately turn opponents into advocates?
So I am an expert on resistance, as I just told you. I think that one has to be persistent. First of all, you have to be pretty sure that what you want to do is for the good. There's an old dictum in medicine: above all, do no harm. And when you have a system which works extremely well, I think the science we do at NIH works well. Introducing change can, as likely as not, really make things worse sometimes. So you need to be fairly sure that what needs to be done is important. And then you just reason with people. And my experience has been that once you establish trust, and one advantage of being in a position for 20 years is people know me well. They know I have their interests and the interests of the NIH and science, the American public, at heart. That you can lead that way, and it's usually by rational argument. I know that in the current era that doesn't maybe not resonate, but I think most people will respond to reasoned argument if they feel that there's trust between the leader and the person who's being led.
Are there other things that you would advise leaders across HHS to do in order to create an environment of innovation among their teams or across the department more generally?
Right. So I think there are differences. We talked a little bit about it, solving problems in administration and solving problems in the laboratory. I think in some ways the science agencies have a pretty clear-cut set of circumstances that foster innovation. So you need very talented people. They need to be given the wherewithal to do their research and enough autonomy so that they can pursue their own dreams, their own ideas. They need a resource like the NIH or another laboratory facility. Some of our physicians benefit enormously from the clinical center, which is the world's largest biomedical clinical research center. And all of those provide an atmosphere in which they can pursue the research that they feel is important. I mentioned also just a few moments ago that it's important that a quality of life be established, quality of scientific life for scientists in which they can do the things that scientists do, plenty of time to think, time to meet with other scientists, to go to scientific meetings, to be parts of professional societies. Those are all essential for the autonomy of a scientific individual. In administration, innovation is extremely important as well, and I think some of the same principles apply. The problems may be more complicated in some ways, as I mentioned, but I think one wants to be able to give people enough autonomy to come up with good ideas, and the ability to work with other people to solve the problems that they are able to define.
Well, Dr. Gottesman, I want to thank you very much for your time this afternoon. Thank you for your public service, and I know not just at the NIH or at HHS, but as a country, we're grateful to have you in your role.
Well, it's been my pleasure, and I hope to keep serving for many more years. Thank you very much.
Thank
Tom.
you.